We are going to talk on the topic of extraction forceps. There are two sets of extraction forceps, the maxillary or the upper extraction forceps and the mandibular or the lower extraction forceps. Each type or each extraction forceps is consisted of three main parts. Number one, the handle. Number two, the joint to open and to close the forceps. Number three, the blade or the beaks of the forceps. For the upper forceps, the handle and the joint and the beaks are in one line or straight, or there are some curvature for accessibility during working. While for the lower forceps, the handle and the blade are perpendicular to each other and there is a right angle in between them. For the types of the upper forceps or the maxillary forceps, they are classified according to the tools to be extracted. Number one, the upper straight or upper anterior forceps. It is mainly used for extraction of upper central, lateral and canine, either right or left. It is characterized by being straight. The handle and the joint and the blade all are in one line together, so it is called upper straight forceps for this reason. For extraction of the upper premolars, either right or left, we are going to use the upper premolar forceps. It differs from the upper straight by there is a slight curvature between the handle and the joint, and also the handle has a slight curvature for accessibility during working in the corner of the mouth. For extraction of molars forceps, we are going to use the upper full crown forceps. It is characterized by having a notch in the blade, in one of the blade, while the other blade is smooth. The blade which has a notch, it is used for engaging the tooth from the buccal aspect, in between the two mesiobuccal and the two buccal roots, mesiobuccal and distobuccal root. While the smooth blade, it is used for engaging the tooth from the palatal aspect. So for the upper full crown forceps, we have the right and the left full crown forceps according to the location of the notch in the buccal beaks. For this, it is the upper left full crown forceps, and this is the upper right full crown forceps. For extraction of remaining roots in the upper jaw, we are going to use the reeds forceps, which is characterized by having a small beaks and a curvature in the handle for accessibility during working. It is used for removing of remaining root of the upper anteriors, premolars and the molars. Because the upper third molar or the wisdom tooth is usually rudimentary and malposed, so we are going to extract it by using the bayonet forceps. We have two types of bayonet, the long closed bayonet and the open bayonet. The closed bayonet is also can be used for extraction of remaining root of the upper molars, and it is also used for extraction of remaining root of the upper wisdom together. While the open bayonet, it is mainly used for extraction of the upper wisdom, which is buccally located, and it is characterized by having a curvature in the blade and in the hand. For the lower forceps, as we have seen, that the handle and the joint and the blade are perpendicular to each other. There is a right angle between the handle and the blade. We have three types only for the lower forceps. We have the lower anterior, which is used for extraction of the lower anterior teeth, central, lateral and the canine. We have the lower premolar forceps, which differs from the lower anterior by having a small space between the buccal and the lingual blade, and also the handle and the blade is also perpendicular to each other. And lastly, we have the lower full crown forceps for extraction of the lower molars teeth 6, 7 and 8, either right and left. So here we have two notches in the buccal and lingual blade, because the tooth from the buccal aspect is similar to its shape from the lingual aspect, because we have only two roots, a mesial and a distal root. So there is no right and left lower full crown, but the upper we have right and left full crown. The elevators. The elevators are mainly used for removal of the remaining roots or luxation of the tooth. There are three types of elevators which are classified according to the principle used. There is three principles: the wedge principle, the lever principle, and the wheel and axle. To apply a wedge principle to luxate the tooth or remove a remaining root, the elevator must be straight. And also any elevator is consisted of three parts. Number 1, the handle. Number 2, the shaft. Number 3, the blade. There are three main types of a straight elevator. Number 1, the straight hospital pattern elevator, which is characterized by having a serration in the blade. Number 2, there is the straight apexo elevator, which is characterized by smooth blade and rounded in cross section. Number 3, there is the Copeland chisel elevator, which is characterized also by straight, by being a straight elevator, and the blade is having a rectangular cross section. So we have three types of a straight elevator: the straight hospital pattern, the straight apexo, and the Copeland chisel elevators. The uses of the straight elevators are luxation of lower wisdom or upper wisdom tooth. Also, it can be used for extraction of single-rooted remaining root. And the principle for using any straight elevator is wedge principle, by applying the elevator in from the buccal aspect in between the two teeth under the gum margin, and apply a slight distal force to remove any wisdom tooth. If we have remaining root of lower full crown or upper full crown teeth which are separated, such as the mesial or distal root of the lower 6, 7, 8, so we have to use a curved elevator. And any curved elevator, the principle to be used with it is the lever principle. And we have several types of curved elevators. Number 1, we have the curved apexo elevator, which we have a mesial and a distal type. Number 2, we have the curved hospital pattern elevator, and also we have the mesial and the distal type to remove either the mesial root or the distal root of the fractured tooth. And we have the buccal applicator, and from its name, the buccal applicator must be applied from the buccal aspect of the fractured tooth to remove the remaining root of the lower full crown, either 6, 7 or 8. It has also another name which is called the Copeland, the crier elevator. It is also called a crier elevator or buccal applicator, and from its name it is applied from the buccal aspect to remove the remaining root of the teeth. The last principle we are going to talk is the wheel and the axle elevator, and there is only one elevator in this category, and it is called the winter elevator or the crossbar elevator, which has a characterized shape. It is mainly used for removal of remaining root of lower full crown, of lower molars 6, 7, 8, while the forcation is still present. That's to say that the mesial and the distal root are in close contact to each other, and the forcation is still in between them. It is applied from the buccal aspect in between the forcation, and this movement is called the wheel and the axle movement. There is two types of this elevator. There is a right winter elevator, and there is the left winter elevator according to the blade which will be inserted in the buccal aspect, not in the lingual aspect. The use of the elevator is mainly contraindicated to be used in the maxillary for removal of maxillary teeth because of the presence of cancellous bone of the maxilla and the nearby structure such as the nasal floor and the maxillary sinus. But for experienced dentists, the elevators can be used in the maxillary teeth. For the beginners, we may use the Warwish-James elevator for extraction of remaining root in the maxillary teeth. Because they are small, so they are also called root tip elevator, and they give a little force so not to endanger the maxillary sinus and the vital structure in the maxilla. We have three types of the Warwish-James elevator. We have the straight Warwish-James, and we have two curved for the mesial and the distal roots of the maxillary molars.